Every 15 minutes, a baby is born with a congenital heart defect. That's nearly 40,000 infants each year in the U.S. alone. I'm Tisha Powell.
And I'm Lee Zurich. Medical advancements over the last several decades have improved survival rates for these infants. And now more than 2 million people have adult congenital heart disease, or ACHD. But cardiologists we spoke with say many survivors of open heart surgeries in the 60s, 70s, and 80s are not receiving the follow-up care they need.
So they are trying to raise awareness to bring this growing population of patients back to specialized care before their conditions become critical.
Good boy.
At 56, Patricia Berkowitz has made staying healthy and active a top priority. She even wears an Apple Watch to track her progress.
I've been wearing an iWatch for a while. Really like keeping track of our, steps and, like all the things that people like to keep track of.
But in 2022,
I'm sitting at my desk and all of a sudden I get an alert.
A message she had never received before.
AFib detected, and I was like, that seems weird.
Tests performed shortly after at Duke University Medical Center confirmed there was a serious issue with Patricia's heart.
Went in, they did an ECG, and I was in a flutter, actually. So the watch was correct. There was a problem.
Patricia's heart problem actually dates back to when she was a baby. Born with a congenital heart defect called an atrial septal defect, she had a hole in the wall between her heart's upper chambers. After a successful surgery just shy of her 5th birthday, she went on to lead a normal life.
I ran track and cross country in high school.
For years, Patricia's heart never held her back.
I was always active, 70s kids. We just got on our bikes and went wherever we went for the day. All the same things.
It wasn't until her 50s that alarms started going off, which research reveals is not uncommon. In the 1950s, only about 25% of infants born with a congenital heart defect would survive to see their first birthday. Today, that number is more than 95%. Experts say it's because of this high survival rate that many ACHD patients have the misconception they are cured. This Journal of the American College of Cardiology article states, in reality, there's almost no surgical cure for congenital heart disease. The article goes on to stress the misperception of cure has potentially serious consequences. Doctors we talk to insist long-term follow-up for these patients is extremely important, even if they feel good.
And it's a little bit like taking your car in for an oil change. It's driving fine, but you have to take it in, and if you don't, then you pay the price.
Dr. Sam Lucas is an interventional pediatric cardiologist and co-director of the Congenital Heart Center at Ochsner Health in New Orleans. Dr. Lucas says for many ACHD patients, there are economic and emotional barriers to care. A 2021 study published in the Cambridge University Press revealed difficulty paying insurance premiums and access to care as the most common barriers for patients.
You might be far from the center where it's difficult to get there, and it could be something as simple as you don't have the gas money or the car that'll make it there.
Dr. Lucas adds doctors want to help patients face their fears so they can find potential problems early.
We want to find any problem that you might have before it's manifest, before you have any symptoms, and that's why we believe very strongly in scheduled regular follow-up and evaluations.
Dr. Lucas says without adequate follow-up care, some ACHD patients may experience right heart failure, or RHF, which can lead to leg swelling, labored breathing, and chest pain. Exercise intolerance and heart rhythm issues are also a concern. These patients can also face sudden adverse cardiac events such as fainting, cardiac arrest, or even death.
There needs to be more awareness about the value of coming back for regular follow-up.
The American Heart Association has made it their mission to get the word out and reach those who need to be evaluated.
We know there are about 2 million adults in this country that have congenital heart disease. Only about half of them truly receive proper cardiovascular care, and I think that's an important fact that the American Heart Association wants to get out there, that there is help. Holes in the heart.
American Heart Association board member and clinical cardiologist Dr. Denzel Moraes says ACHD patients should consider the simple things first, such as maintaining a good diet and getting some exercise. He adds, due to recent medical advancements, open heart surgery may not be necessary for ACHD patients who need treatment later in life.
We can place Holter valves in through the groin. We can do ablations percutaneously as well. So there are multiple things we can offer at regional centers of excellence.
Ablation, a procedure that destroys abnormal heart tissue, was used to treat Patricia's irregular heart rhythm.
That's when I was in a flutter.
Her biggest concern now is her risk for stroke, often associated with arrhythmia. She's currently on a blood thinner indefinitely and understands the importance of sticking to a regular appointment schedule with her cardiac team at Duke. She also keeps her Apple Watch and iPhone close by.
You just look at the little heart health, and it pulls up all, and you can set it to send you messages, like weekly alerts. Really using these tools makes you really comfortable with keeping up with what's going on and not freaking out.
Reminders that managing heart disease is not just a thing of the past, but a crucial part of ensuring a healthy future. Cardiologists recommend making the transition from a pediatric cardiologist to an adult cardiologist between the ages of 15 and 18. If you haven't been to a specialist in a while, start with seeing your primary care physician.